Now, generally speaking, it's a fibromuscular organ, so that means it has a lot of connective tissues along with muscles. Of course, muscles are connective tissue, but what else? Now, we learned about the borders. It's located in the medial mediastinum. Of course, it's self-evident because whatever is located in the medial mediastinum is, of course, quite pointed or quite close to the lung. So whatever is quite close to the lung is the medial mediastinum. Then we have okay. So look at the heart, and the first thing that you see when you look at the heart is the pleural pericardium. Then we have the location near the pulmons or the lungs, and then if you look at the weight of the heart is about 250 to 300 grams. That's about the weight of a large, in fact, a large orange or maybe a jar of Nutella. So that's all. And if you look at the size, it's about 12 centimeters. That's from front to the bottom. But if you cut the heart, you can see that it's about 8 to 9 centimeter. No, it's about 9 centimeter. 6 centimeter anterior-posteriorly. So 12 and 6. Remember, like 6 into 2 is 12. So 12 anterior-posteriorly, and then we have 6 if you cut the heart. And then if you like take a tape and if you measure the heart, if you look at if you measure the heart around, like transversely, you can see that's about 8 to 9 centimeter. So that's all. And of course, the size of the heart in males is more as compared to females. Okay, so if you look at the heart, you can see that it's obliquely placed in the thoracic cavity, and it has surfaces that is and also borders. So if you look at the surfaces, you can see that there is a sternocostal surface, and as the name suggests, it's closer to the sternum and also to the costas or the ribs. And then we have the diaphragmatic surface that is always closer to the diaphragm. Then we have the upper border, and then that's the surface. That's the anterior, the inferior, and the right and left. Of course, the heart is placed in the middle, so it should have two surfaces that are lateral. That means it has two pulmonary surfaces. Then we have the borders. The borders are termed as upper, inferior, left, and right. And although so we know for the fact that the heart is divided into 4 chambers, and this leads to some visible external grooves that are also known as sulci. Now, these grooves might be obvious or prominent in some cases. So there are some major grooves that are actually prominent, and most of these grooves are sort of subtle. They are not usually out there, and they're obscured. So we won't talk about that. So let's talk about the more grooves, the external prominent grooves. These include the interatrial grooves. So as the name suggests, interatrial. Just look at the chambers and name it according to the chambers. So we have the interatrial that goes and passes towards between the two grooves and separates the two atrias. Then what do we have after the atria? We have the ventricles. So we have the atrioventricular groove, or the coronary groove, the fancy name, the coronary, or the crown of the heart. So that's another thing. And so the coronary groove is sort of strange because it descends from the sternocostal region, and it goes because of course the heart is oblique in nature, so of course the coronary groove will also be oblique in nature, and parts of it are obscured by the pulmonary trunk. The coronary groove, did I say coronary? No. Okay, so basically the coronary groove, it descends in an oblique way from the apex, from the base of the heart, descends in an oblique way, and then some parts of it are obscured by the pulmonary groove. So that's one of the major grooves. Because of course we know that on the left side we have the pulmonary trunk, and then posterior to the pulmonary trunk, because on the right side of the pulmonary trunk we have the aorta, from which the coronary arteries originate. Of course, the coronary arteries are quite important for the coronary groove because, of course, these are the ones that are going to be providing the heart. This groove then, it curves around the obtuse margin. So remember, there's the obtuse margin and the acute margin. The obtuse margin is the one that's bigger and basically is located at the crown of the heart. And then we have the acute margin that's less approximately near the apex. This coronary sulcus is quite important due to the fact that it separates the two atrial, the bases of the atrium from the ventricles, from the anterior or the superior side of the ventricles. Then we have the mural margins. Now, what are mural margins? So, supposedly they are said to be the division between the two ventricles, of course, and they're quite faint in nature. So we can also name them as the interventricular grooves. The interventricular groove or the mural line, it extends all the way from the atrioventricular groove or the coronary sulcus, and it extends all the way to the apical notch of the acute margin. So when I say the apical notch, that means the most prominent notch of the apex at the acute margin. So remember when I said earlier that the acute margin is located more near the apex of the heart and the obtuse margin is located near the base of the heart. So now it is also noteworthy to remember that just as we had the interventricular grooves, we also have something known as the interatrial groove that is between the two atriums. So just a clinical point of view, the auscultations that you do at the heart are usually at the clinical base rather than the apex. So in order to know where the clinical base is, it's important to know where the beat is the highest. So it's near the base, and well, that's it.
Now, let us look at the borders of the heart. Okay, just let's specifically, let us just start looking at the apex of the heart. The apex of the heart is conical and is aligned obliquely. So, of course, if you look at the apex, it's more aligned to the left. And it's most commonly behind the fifth left intercostal space. So the fifth rib is more closer to this area. So now let us look at the borders of the heart. Now we already know the surfaces, we know the angles, then we know the alignment. Now the last thing to look upon is the border. So we have the upper border of the heart. That's also known as the atrial border because of course near the upper border or near the base we have the atrium. So it's most closely related to the pulmonary trunk and the aorta, the ascending aorta to be more precise. And then we have the supravena cava that enters the right atrium. So all of these are in association with the upper border of the heart. The right border of the heart is the one that's slightly convex. So remember that the right one is associated with oxygenated blood and deoxygenated blood. So the right part is near the vena cava and is convex in nature. That means it protrudes out. So then we have the inferior border of the heart. That's basically the diaphragm. And lastly, we have the left border of the heart, which is the right and the left border of the heart usually are the ones that are more corresponding to the right and the left atrium, and then we also have some parts of the pulmons, but it's important not to just it's good if we don't include the pulmons here. So the inferior border of the heart, also there's an acute margin of the heart. The inferior border is sharp, thin, and horizontal. As I said earlier, this is the apical point or the apical point of the apex. Alright, so moving on to let's look at the right auricle or the right atrium and the right atrium. So the right atrium, in order to describe it, let's describe the external features first and then move on to the internal features. So externally we can see that this is the one that's located quite towards the right, as the name suggests. Its border is convex in nature and is right to the left atrium. And if you look at it, you can see that it's actually we have on the dome of the atrium, we have the insertion of the inferior vena cava, of the superior vena cava, and the inferior vena cava comes into it from the inferior posterior part. So remember, this is the inferior posterior part. Then we have a muscular pouch, the appendage, that overlaps the right side of the ascending aorta. So remember the fact that the base of the heart, it has a lot of major great vessels coming out. So we have the superior vena cava, and then next adjacent to it we have also the what was called a ascending aorta. So there's a small covering, a small extension of the atrium on the external side. That's also known as the auricle that covers this part. The junction between the venous part of the atrium is marked by a shallow groove called the sulcus terminalis. So the external part, we see a sulcus, called as the sulcus terminalis. So that was all about no. So okay. So remember that there was this the two entrance of the two major vessels, and then the terminal sulcus terminalis. So sulcus terminalis is the border or the line that extends from the inferior vena cava to the superior vena cava to the inferior vena cava. That's the line. And then that's externally, if you look at the groove, it's known as the sulcus terminalis, but the internal side of the same groove is known as the crest or the terminal crest or kysta terminalis. And this is also the site and the origin of extensive pectinate muscles that arise from the crest itself. So in order to demarcate the external markings of the atria, it's important to divide all the markings into the left and the right regions. So it's situated in the right. So if you look at the right part, we have a sulcus terminalis and the terminal crest. So that's the right region, and then to the left we have the left atrium that's in close proximity to it. So of course what we're going to have here, it's the interatrial groove. So posteriorly we have the pulmonary veins, and anteriorly can see that there is a line, the mural lines or the mural folding that indicates the interatrial groove. Okay, so internally we can see that there is this thing called as the smooth side, which is the internal smooth venous component that's located posteriorly, and it leads to the tricuspid wall. Now remembering the walls here is important because we have the superior and the inferior vena cava, and each one of them have their own wall. Moreover, we also have something known as a coronary sinus here that that's basically the origination from the sinus venosus of the embryonic heart. So majority, apart from the smooth surface, there's also tuberculated regions and regions that consist of the pectinate muscles here. So now we have the entry of the superior vena cava on the base of the heart near the superior side of the atrium, and then the superior vena cava is the one that drains the entire head, neck, and upper limb. Then we have something known as the inferior vena cava that's quite larger than the superior counterpart. It drains blood from all structure below, including the diaphragm. So it's important to know what's the orifice of this. This orifice is guarded by a flap-like structure known as the eustachian wall. I'm talking about the inferior vena cava, and it. If you trace the eustachian tube downwards all the way from the eustachian ridge, you can see that there is the coronary sinus, the flap that guards the coronary sinus. The coronary sinus opens into the venous atrial component between the orifice of the inferior vena cava, the fossa ovalis. There is also another structure known as the fossa ovalis, which is known as the remnant of the embryonic period. So that's just like a major landmark. You can ignore that. So now there's a small structure that joins the fossa ovalis and the coronary sinus. This is known as the tendon of Todaro, so remember that. Apart from the tendon of Todaro, we also have an area to which the tendon of Todaro enters. It's known as the triangular area, or known as the angle of Koch. So that's another thing. And then we have the ostium of the coronary sinus that forms another prominent landmark. Now, remember that I talked about the crista terminalis, or the terminal sulcus, that basically is at the right border of the right ventricle. So here we have another landmark here known as the sinoatrial node. So internal to the crista terminalis, we have a terminal crest, and where the terminal crest ends, we have something known as the sinoatrial node. So it's located at the superior part of the groove. I stand corrected. So it's not at the end, but it's on the superior part of groove, infralateral to the orifice of the suprarenal cava. So below and laterally, that below and to the side of the infrarenal cava, there's also something I talked about, the triangle of Koch. So the most surgical importance of the triangle of Koch is the indication of the atrioventricular node. So that was the sinoatrial node, and near the triangular Koch we have another triangle of Koch. We have another node known as the atrioventricular node. So both of the important nodes are located in this atrium. It's also noteworthy to remember that there is a separation from the rough part to the smooth due to the fact that there is the presence of the pectinate muscles near the crest, the terminal crest. Then we also have something known as the fossa ovalis that's present between the two atria near the atrial septum.